One of the great dilemma is the issue of consenting. During consent, there isn't really very clear guideline how much information you need to give to the patient.
When you're talking with somebody about consent for an anaesthetic, do you say, well, actually, there's a chance of death? What does that do to somebody's state of mind if they're coming in for a relatively routine surgery, which almost everybody is going to survive, except maybe one person every 5 years on a national basis? How do you talk about that sort of thing to somebody who's actually anxious enough about everything else?
Informed consent is should be obtained when the person has got all the mental capacity. Otherwise, I think it is a big dilemma for the doctors.
Training for ethical dilemmas is a difficult one because it is much more difficult to train in the static classroom lecture type approach, even a seminar. It does require some fairly interactive stuff or requires quite a bit of interaction with whoever is training, mentoring you. So it's not something which is easily trained into people, but the principles are clearly, but the practice requires you to reflect. And reflective practice is difficult in the NHS at any time, but seems to be getting increasingly more difficult because it requires you to take time out and to think.
Things like ethical issues, like anything actually, you've got to throw money at it. And I don't mean cash, I mean time. People have to be given time to be reflective and to talk and to feel comfortable in talking about ethical issues and thorny issues that they encounter.
Supporting doctors who are facing ethical dilemmas does require actually that first step to be easy. In other words, the doctors often do recognise there's something, the difficulty they're facing, but actually it's then knowing that they have someone, it's always someone, who they will be able to make contact with to talk that through.
All doctors are going to make mistakes. And we all need to feel that even though we make mistakes sometimes, that we are supported. And we also need to feel comfortable and acknowledging when we are finding things difficult.